Boris Johnson is being accused of undermining the fight against COVID-19 by launching a reorganisation of the NHS in England in the middle of the pandemic. The Health Secretary Matt Hancock is today announcing a shake-up that he claims is based on lessons learned from COVID and will slash red tape. But doctors say now is not the time.
Some of my colleagues, I think, thinks it sort of beggars belief, really, that this is happening at this time when the NHS is in turmoil. You know, we don't need reorganisation. We need a period of stability and investment.
The shake-up, which rips up the NHS reforms introduced by David Cameron's coalition government in 2012, is said to have been triggered by Mr Johnson's frustration over the initial NHS response to coronavirus and his determination to take back overall control of health policy.
The government is looking at restructuring the NHS. Do you think we do need
On Sky's COVID crisis, learning the lessons, there was backing for the reforms.
I think we need to make this a really big moment in the NHS's history because it's just been through the biggest challenge. Every single patient who's needed a ventilator, who's needed an intensive care bed, has got one. They'd like to know that there was a proper plan in place so that over time we can start to deal with some of these gaps in the workforce.
As well as NHS reorganisation, the proposed legislation will also include measures to tackle obesity and the advertising of junk food before the 9 p.m. watershed. Labour is criticising the lack of proposals on social care in the White Paper.
I'm disappointed there's almost nothing on social care in the proposals. We'll look at the details, but to leave out social care, I think, is to fail again to address what's been a very, very real problem in this pandemic.
But it's the timing of the shake-up and accusations of a power grab that are most contentious. John Craig, Sky News.